if you're on this live feed, you're probably thinking, okay, I want to see what Dr. Jackie has to say about hair health. You probably have struggled with hair loss, maybe some thinning, maybe it's coming out more in the shower, maybe in your hairbrush, or it's actually coming out in clumps from the root. And so today I wanted to address a few of those things, but also what we can do to help you. And so my goal for you is to give you those healthy, gorgeous, and strong locks that you've dreamed of, right? Anybody else want healthy looking, gorgeous hair? Give me a thumbs up. So in this live, I'm going to explain how we can do that. Okay, so first we need to do some detective work. There are many different factors at play when it comes to creating healthy hair follicles. And so as a naturopathic doctor, we're trained to address the whole body and find that root cause, pun intended. That's why I've created a hair loss and thinning questionnaire. And so if you've been reading up on my social media posts, I did send out a link where you can get the questionnaire. However, if you're on this for the first time, you haven't seen that, that's fine. You can direct message me and I can send you the questionnaire right to your inbox and you can look at it and fill it out. And basically what this questionnaire does is it goes through a whole bunch of questions involving hair growth, hair loss, and where it's thinning. And so we have to do this because hair thinning and hair loss takes 6 months. That means that whatever happened 6 months ago is affecting your hair now. And so you can see how it's not that easy to pinpoint exactly what's going on. And so I want to talk to you today about something called a Dutch test. So there are many investigations that we can look into once the questionnaire is completed. Basically what the questionnaire does is it gives me the type of hair loss that you're experiencing. So whether it might be a hormonal cause or nutrient cause or even an STD or an autoimmune relation. And then from there, what I do is now we target with testing. I always recommend testing when it comes to hair growth because otherwise you're just doing a Band-Aid approach. You're not addressing the root cause, you're just guessing, and you're probably getting super frustrated, right? It does take 6 months to regrow and it happened 6 months ago. So it's hard to pinpoint if what you're doing is working unless you've already done the testing to find out exactly what the cause was so that we can now put you on a fine tailored treatment plan that in the next 6 months you can be like, yes, okay, we fixed that problem. Does that sound good, guys? Give me a wave or a thumbs up if this sounds like a good idea, right? Okay. So one thing I have noticed just in my career and practice, the most common reason for hair loss is something called androgenic alopecia, and that's for both men and women. So in men, it's the male pattern baldness where they start doing the comb over, right? So that same cause of male pattern baldness is different in women. So in women, it's not necessarily fully falling out, but what happens is we start getting thinning, and you'll notice it mostly in the vertex, so right at the back, the crown, and then you're gonna also notice in your part. So wherever you part your hair, it will start going further and further away, and you'll just notice that there's more space. You can also get some thinning in the actual section here. In Chinese medicine, we call it stomach 8. But in this here, it can start receding backwards. And so why am I talking so much about this one? It's the most common, and the one that is all about hormones. So in women, we know our hormones fluctuate like crazy, right? They're up, down, all around. And then if you're not nourishing your body properly, they can really get out of whack. So we have something called the 28-day cycle where our menstruation goes and we have estrogen and then we have progesterone, and it's up and down all around, right? One of the main causes of androgenic alopecia is too much testosterone being converted into bad androgens. So the bad androgens is what's causing that hair loss. Now we have good androgens as well. So when we see that on the Dutch hormone test, we address that by converting the bad androgens to the good androgens. Okay, and so I've thrown out the word Dutch hormone test a lot now, and you're probably like, what is this, right? Okay, I'm going to explain the difference between that hormone test and your conventional doctor's hormone test. So if you're getting your hormones checked by your doctor, what are they going to do? They're going to send you off to a Life Labs and get a blood draw. So the blood draw, I like to use an analogy with money to make it easier to understand. The blood draw shows us how much money is in your wallet. So I don't know about you, but if I check my wallet right now, I probably have a quarter and a dime, but that's not reflective of how much money I actually have, right? So the same thing's true for the hormones. Is hormones are fat soluble. That means they like fat. They like to be in cells. They like to be in tissues. They do not like to be in the blood. The blood is water soluble. And so when we do a snapshot in time in the blood, we're only getting a small, tiny picture of what's available. The other test that I'm not explaining today because it's more for menstruation and for figuring out that cycle, it's called a salivary test. So that one, in the money analogy, actually shows us the amount of money in our bank account at a specific point in time. So oftentimes we'll do a salivary swab, or you can spit into a tube for several days to see where your hormones are in different areas of your cycle, because it should be like that curve, right? And so that's very helpful when we're looking at fertility, let's say. Now, it may not be helpful though for what we're looking for, which today is hair loss, right? And so the Dutch test, which is a urinary test, what it does that's different from everything else is it's checking metabolites. And so let's go back to that money analogy. So we're not just looking at the amount of money that we have. What we're checking is, where are we spending our money? What have we overpaid? What have we underpaid, right? And so what's nice about that is it's not just a snapshot in time, it's telling us, okay, these systems are working great, these systems are not working. And so we're not able to get that hormone cleared or converted. And so when it comes to using this test for hair loss, we'll see not just hormones, so androgenic alopecia is great because it shows us the androgens, but it's going to also show us your stress levels, if your adrenal glands are functioning properly, if you have proper nutrients, there are some nutrient markers, and if you have any type of inflammatory response or oxidative stress. All of those things affect your hair. So, pretty good test to cover all of our bases, right? Now, there are some other tests that we may need to look into based on your specific answers to the questionnaire. Earlier, I did say a little bit about how autoimmune or STDs can affect your hair growth as well. And so if we're thinking that could be lupus or thyroid or something like that, we'd have to do additional testing. And I'm going to leave that with you today. Mull over all the information that we went through. if you are interested in that Dutch hormone complete test to see whether or not your hair loss is related to your hormones, your stress levels, your inflammation, any nutrient potential deficiencies in your adrenal function, we offer it at all the locations. And actually, it can be sent right to your door. So send me a message if you're interested, and then I will get back to you as soon as this is over. Awesome.